and thank you for watching this very brief presentation where we'll discuss some advice and tips to help you find the best Medicare Part D prescription drug plan. My name is Jesse Sloan. I'm director of the American Association for Medicare Supplement Insurance. For 25 years, our whole focus has been consumer advocacy, providing relevant information to help seniors and others learn more about their Medicare insurance options. And if you get value from watching this video, I'd really appreciate if you do me a favor and click the like button. That tells other consumers that it's a video they should consider taking a look at. So when it comes to Medicare Part D or prescription drug plans, here are a couple of things that you need to know. Nationally, there are about 770, a little bit more than that, different plans that are available. But that's not a relevant number to you. What matters to you is how many plans are available locally. Medicare Part D plans are zip code based. That means that the plan for you is going to be very different than the plan for your neighbor who lives, a town or two towns away in a different zip code. And so you really want to only focus on which plans are available for your particular needs. Now, you're going to hear a lot of information out there and you're going to hear noise, or not noise, you're going to hear things from the leading companies that are out there. And there are a few of them that comprise the majority of all drug plans, and they're all excellent companies. But that doesn't mean that the other companies that are out there don't have good offerings. And the other companies might indeed be your best choice. For example, each state typically has a Blue Cross and or a Blue Shield plan. Well, those won't have national numbers, but they certainly could provide you with excellent coverage and an excellent cost. Now, what you need to understand when it comes to Part D plans is that each insurer files their own particular plan, and some of them have multiple options available. And so the prices are going to differ, sometimes really significantly, and it's going to be based specifically on the drugs that you take. Some will cover a drug to a certain amount, some will cover the same drug to a different amount. So it's very, very personal. The plan that is best for you is not going to necessarily be best for your spouse, your partner, your neighbor, your friends down the street, etc. It's really just the plan that's best for you based on the drugs that you take. To help you find, the association provides access to an online, very easy to use lookup. It's completely private, which means that the only thing you have to enter is your zip code. No personal information, no names, no emails. Nobody wants to, at this point, know who you are. And in this case, you'll see I entered the zip code for where the association is based, 91361. You click Find Plans, and the system will automatically bring up all the available plans. I think there are about 20 for this particular zip code. And what you can clearly see is that Aetna has an offering for $7.50 a month. Blue Shield of California has an offering for $160 a month. Does that mean that the Aetna is the best plan for me? Maybe, maybe not. What this system allows you to do, and what you really have to do, is you have to have a list of your drugs and the dosages. And you're going to use the tool to enter the RX drugs, and they're very easy to pull up and to find, and then compare. And you can even add the pharmacies that you use, because it could be mail order, it could be your local pharmacy if you prefer. And that way, the system will show you which is the best plan for you in terms of lowest premium for the most coverage. And that's, again, something that we really urge every individual to do. You certainly should do it once a year during Medicare's annual enrollment period, which runs from October 15th through December 7th. But if you're watching this at a different time, it's a good exercise to take a few minutes and to do it. You can access the tool and much more information on our website, medicaresup.org Part D. And again, if you got value from this video, please give it a thumbs up on YouTube. Thanks for taking the time to watch.